take her away and tell us a little bit about your work as Lieutenant Governor, a little bit about your work as candidate for governor, and what's commanding your attention these days.
Yeah, well, I appreciate you so much for having me on. Thank you to everyone who's able to join here. And as mentioned, my name is Lieutenant Governor Justin Fairfax. I'm very proud to represent all 8.5 million Virginians and to have done so for the last nearly 4 years. Time has sort of flown by here, but also proud of the record that we've been able to put together, helping all Virginians to succeed and to thrive. And particularly, I know we're going to talk a little bit about healthcare today, which is such an important topic. I'll say that my most proud day in leading the Senate as Lieutenant Governor was when I was able to break the tie votes to expand Medicaid here in the Commonwealth of Virginia. And to date, over 528,000 more Virginians now have health insurance as a result of the work of so many people in those tie-breaking votes. And we know now, in the midst of this COVID-19 pandemic, more than ever, that it is critical that we have people have access to affordable, high-quality health care. We are negotiating this pandemic and hopefully going to come out on the other side of this very soon. We'll talk a little bit about what we've been able to do to get us this far. But we know that people are in jeopardy when it comes to their health, when it comes to the economy, and other means. And so we want to make sure that we're there for them, that Virginians coming out of this not simply surviving, but thriving. And that's also what I'm doing in my campaign for the governorship, is to make sure that we are meeting the needs of Virginians where they are, lifting them up all around the Commonwealth, and ensuring they have the opportunity to achieve the American dream and to thrive as we make these investments that will transform their futures. And so really appreciate the opportunity to be on with you, to talk a little bit more about our work and what we can all do together to help all 8.5 million Virginians.
So Lieutenant Governor, give us a sense just of, you've obviously run for statewide office before, and give us a sense of what this run for statewide office has been like, as an individual. We'll get into policy and politics and all that stuff, but personally, what has this been like?
As you mentioned, I have run for statewide office before, actually twice, and I ran for Attorney General of Virginia back in 2013. Seems like a lifetime ago, and we came very close in that election in the primary. Won a little over 48% of the statewide vote, but didn't quite get there. And so 4 years later, ran for Lieutenant Governor. We were successful in the primary, having won a little over 48% of the vote again, and in the general election. And this time, it really is an opportunity to continue to connect with those communities that I've been very fortunate to get to know very well over the last nearly decade, and understanding their needs from the ground level, from the community level, understanding the needs of small business owners and faith communities and families and school districts, and really crafting solutions that meet the needs that they have. And of course, being adaptable in this environment with COVID-19, it really has exposed so many of the inequalities, the inefficiencies in our society, and so much of the work that we all have to do to make sure that no one falls through the cracks and we're lifting everyone up. And so it's been different this time, obviously, in the virtual environment, which we're in right now, having to contend with some of those external factors. But it also has been, I think, really important in this moment to highlight public service, reaching out to each other, and making sure that we're all getting through this together. And so it's been a unique experience running this time in that way, but also one that I think is uplifting.
So how do you think that health politics, the health policy, let me ask it this way, how have the politics of health policy impacted this race, either directly or contextually? How is this election shaping the health policy conversations Virginia will be having in a year?
Tremendously. I think that this pandemic has put forward front and center the importance of our health policy, of access to affordable, high-quality health care. In this case, of course, also access to vaccines, which we have seen really be not just in Virginia, but around the nation, around the world, become of paramount importance to people's health and getting through this pandemic. I'm proud that in Virginia, we really are making tremendous strides to get people vaccinated. We've received now somewhere in the order of about 7.5 million doses We administered about 81% of those, about 6 million. We have about 40+% of our population has received at least one dose so far, and about a third of our population, about 2.5 million people, are already fully vaccinated. And so it is work that we have to engage in every single day to make sure that we are delivering, and also to make sure that we're doing so equitably, and we're not leaving communities that historically have been left behind out of the scope of our efforts here to vaccinate everyone. So, but really, what it does is I think reframes the debate in every context to say, how do we then going forward rebuild in a manner that addresses what has been exposed during this COVID-19 pandemic? How do we make sure that people have adequate, not just jobs, but adequate wages to take care of their families? You mentioned specifically healthcare, and that is of paramount importance. We have about 600,000 to 700,000 Virginians who are uninsured today. About nearly 100,000 of them are children. And so I think we have got to redouble our efforts to get not only our adult population insured, but our children insured through the various means that we have currently and that are coming online. So we know that we'll have a state-based exchange here in 2023, and we're making preparations for that. But we also have access to, in addition to the expanded Medicaid, which, as I mentioned, about 528,000 now newly on the roll since it was expanded, about 120,000 just since March of last year, when the governor declared a state of emergency when this pandemic fully hit here in Virginia. But we also know that we have access to FAMIS and FAMIS Plus for our children under 19. We've got to make sure that we're streamlining the process to get them insured. About 46% or so, 46,000, nearly half or so of our children are eligible of that nearly 100,000 to receive that insurance today. And I think we've got to make sure that we're doing everything to make sure that they have access and they get signed up for that insurance. And with adults, particularly for working families, this has been a huge issue. When, as you know, a breadwinner, a working adult, working members of the family get ill, it has a cascading impact negatively on that family, on that community, and ultimately, I think, on our economy, our society. So about of the uninsured, about 82% come from working families. And so we have really got to hone in and redouble our efforts to make sure that everyone gets insured, has access to that high quality care. And coming out of this pandemic, we are addressing many of the disparities that existed even coming into it.
So where would you say, for Democratic primary voters who, like you, admire you, like and admire some of your primary opponents, where would you say are some of the brightest contrasts between your views on healthcare and health policy and some of the other candidates?
Yeah, I would say in a couple of respects. One is on accomplishments. As I mentioned, I cast the tie-breaking votes to expand Medicaid here in Virginia. It was something that I, campaigned on, that I fought for, alongside many others. But when it came down to making sure this got done, and in the Senate of Virginia, executing on something that was a top priority for the governor, for the administration, for our Commonwealth, I, as Lieutenant Governor, was able to make sure that was done properly, and that we achieved what now has given health insurance to 528,000 Virginians. So I think that's a very important thing to talk about. Also, I think that understanding that so many of these issues, when we talk about health policy, are interconnected. I understand that our healthcare policy is connected to our housing policy. This is something that I've led on from my earliest days as Lieutenant Governor. We have a housing and evictions crisis in the Commonwealth of Virginia. There was a study done that said that the top 10 evicting jurisdictions in the nation, 5 of them are in Virginia, with Richmond being number 2. And that, of course, has a tremendously deleterious effect on communities when you have that housing insecurity, on health, determinants of health outcomes. And so we not only got millions of dollars put into Affordable Housing Trust Fund to ensure there's more affordable housing going forward. We began to revise laws around evictions. We know in this COVID-19 environment, even more Virginians Some estimates have it as high as nearly 300,000 Virginians are facing the prospect of eviction from a home or an apartment or other dwelling. And so we have got to connect up our healthcare policy and understand it holistically. It's connected to housing policy. It's also connected to issues around criminal justice reform, which I continue to lead on as well, and also to education. And this is something that I was the first, I think, candidate in this race to really produce a transformational educational investment plan here in Virginia, something that we call the 40-30-10 plan, which would rebuild and reimagine every K-12 public school in the Commonwealth of Virginia that's at least 40 years old with a $30 billion investment, and that's billion with a B, and to do that within 10 years. As part of that, we would pay teachers above the national average for the first time in the history of the Commonwealth of Virginia, and we would guarantee a summer enrichment opportunity, a job, academic, athletic, arts opportunity to every young person in Virginia under our plan. And so what we have seen as the schools have closed, and I also was the, I think, the first statewide official to recommend to Governor Northam last March that we in fact close our K-12 public schools to begin to get ahead of this coronavirus spread. And when I made that recommendation to the governor, which he did about a week later, only one other state in the nation had closed all of its public schools, and that was Kansas. And so that was an opportunity for us to really show leadership, to be bold, to be ahead of the curve. And on the day that I made the recommendation, just to put the numbers in this context, we only had 77 confirmed COVID-19 cases in the Commonwealth of Virginia on that day, last March, which you contrast that with where we are today, over 652,000 confirmed cases. And of course, those grew exponentially in the weeks, in the months right after the declared state of emergency. So I think leadership through the COVID-19 pandemic, helping the Commonwealth respond effectively, keeping our communities safe by making some of those really important strategic calls, and also understanding, again, that healthcare policy is something that is linked to other systems and aspects of our society that we have to, if we truly want to have the healthiest population that we can have and the strongest economic workforce that we can have, we have got to address healthcare in that context. And I think that's really what separates us.
What do you think? Crises are always an opportunity. They present themselves as a mirror unto ourselves sometimes. And what do you think this pandemic experience has taught Virginians about living in Virginia, about Virginia society? What have we learned about ourselves here in this moment?
It's a great question. I think we've learned a few key things. One is that we're all interconnected. And we truly are a commonwealth, that you cannot have simply one part of our commonwealth do well and the others suffer. And we learned that in a very real and a very direct and tangible way. As this virus began to spread, you're only as strong as your weakest links. And so we have got to shore up, again, in the healthcare context, but really in all of these contexts, every part of the Commonwealth of Virginia, we are truly bound together, and our fate and our outcomes are bound together. And we get that reminder through this pandemic. I think we also got a reminder of the resilience of Virginians, that, when faced with a crisis of this size and this enormity, which we have not seen, certainly in my lifetime, and in a pandemic like this in 100 years, although it's a shock to the system as this began to take hold in Virginia and around the world, literally, we saw Virginians band together, even as we saw job losses begin to increase dramatically. We went from a historic low of about 2.5% unemployment to skyrocketing up to about 11%. We're back down to a little over 5%, but that's a huge shock to our economy. And what we saw in terms of the infection rates and hospitalizations and the death totals, which today we unfortunately lost 10,700 Virginians. It really is something that tests who we are. But we didn't fold. We didn't say that we can't do this. We Instead, got together, buckled down, used all of our resources, including in our communities. We have people stepping up in our faith communities and our not-for-profit, educational sectors, and everybody wanted to lend and pitch in to make sure that we're getting through this. And that was inspiring to me. It was a reminder of who we are when we're at our best. And I think that those are some of the lessons that will hopefully endure, so that when we rebuild, we are doing so to rebuild every part of the Commonwealth and understanding that we have to do this together.
Well, Lieutenant Governor Justin Fairfax, I will tell you, of course, we invited all of the major candidates from the major parties to join us. Some of them were willing as long as we would give them all of the questions in advance. Some of them were willing as long as they didn't have to talk about healthcare. You were the only one who was willing to take any question I threw at you and didn't want it scripted. I really appreciate you making time to be with our audience. Thank you, Lieutenant Governor Justin Fairfax, candidate for Governor of the Commonwealth of Virginia.
Thank you all so much. Take care.